On the 8th, the first official World Skin Health Day was inaugurated to, among other things, raise awareness and action towards achieving skin health for all, which, by the way, is the theme for the year's celebration. Nigeria has an additional good news, as Seravi, one of the global partners of this year's Skin Health Awareness campaign, just partnered our own Kunga Health, the health vertical of Kunga.com. Although World Skin Health Day was first established in 2013, this year marks the first time that global celebrations and acknowledgement have taken place on the same day. Welcome to another intriguing episode of Talking Health. Thanks for keeping the date with me. To speak to the issue of skin health, I'll be chatting with Dr. Ladi Alakija, the Medical Director of JLT Specialist Clinic and Skin Center here in Lagos. Dr. Alakija bagged an MBBSc degree from the Lagos University Medical School, Idiaraba, Lagos, in 1973. That is 51 years ago. He is a graduate and fellow of the West African College of Physicians, and in 1978, he bagged a diplomate in dermatology from London University and has since been a consultant dermatologist. Thanks for joining me, Doctor. It's really a pleasure you allowing us into your space.
Thank you very much. It's my pleasure.
Thank you, Doctor. Now, without much ado, let's look at when we hear about skin health, what exactly are we talking about?
Anytime you talk about skin health, we're talking about what a dermatologist would do on the skin. I would start by telling you or defining what exactly is a dermatologist. A dermatologist is a medically qualified doctor who has been trained in the art of skin, the hair, and the nail diseases. Those are the three. A lot of people tend to confuse a dermatologist to a cosmetologist.
I see.
When we're not the same.
Okay.
Cosmetologists, they tend to deal with, usually they're not doctors, they're not medically trained doctors, but they tend to deal with, doing the hairs and painting the face, making either a man or a woman attractive. But we tend to deal with diseases of the skin, the diseases of the hair, and the nails.
Okay.
So that's the difference between the two of us.
Okay. So when we talk about, skin health and its importance, how important is the skin health to overall well-being of a human being?
Let me start by telling you that the skin is the largest organ in the body.
Absolutely.
As you can easily see, skin starts from your head, your scalp, your face, goes to the neck, to the trunk, and it covers the whole body. And it's the largest organ in the body. The next largest is perhaps the liver, but the liver is inside the body. So skin is exposed to the environment, which is the reason why it's important to look after the skin.
So what are the common factors actually that affect skin health?
Well, if you go out of your house, you go to the environment, sun, you're exposed to sun. And of course, the sun has got ultraviolet rays, radiation. You've got the ultraviolet radiation A in the A band, you've got the ultraviolet radiation in the B band. Although, close to 90-95% of the ultraviolet rays that come from the sun is the A band, not the B band.
Okay.
B also comes through, but it's the A band that you get a lot of percentage of the ultraviolet radiation which hits the skin. And of course, the ultraviolet radiation, they got some side effects. So it's important to... Also, you got some bacteria, some viruses that are all over the place. They hit the skin and they can cause diseases, which is where the dermatologists come in.
Okay. So having known this, what are some basic steps everyone should note about taking care of their skin on a daily basis?
Well, I guess because you know that the skin is exposed to the environment, bacteria, virus, and things like that. Is exposed to heat, high temperatures. So it is important to make sure that the skin that covers your body is well taken care of. So basically, that's why you need to look after your skin, really.
Why is it important, if at all it's important, for people to, determine or discover what their skin type or skin types are? And how can they determine the skin type? Is there a way to do that so that they can know how to properly take care of their skins?
Well, when you're talking of skin types, the black race
Yes.
is there, the Caucasians,
Yes.
the white race is
Yes.
there. The fact that basically these two types of skin are prone to certain medical skin conditions. It sounds to reason that if you've got a Caucasian with, say, white skin, who, say, lives in Australia, where you've got a lot of sun rays, they're more prone to cancer of the skin. They should have it at the back of their minds that, because my skin is Caucasian and I live in Australia, I've got to be very, very careful so that they don't now have skin cancers. Which is not the case if, say, somebody is a black skin. They don't get as much skin cancers as somebody, say, who lives in Australia. So that's the reason why it's important for people with different skin types. And like I said, those are the main skin types. It's not like checking your blood group. No, there is no test that you do to say, this skin type is A or B or C. No, it's not done. But because, again, if you live in a particular environment and you know that because you live in that particular environment, you could be prone to certain skin diseases, that's why you have to be careful if you might get any of those diseases.
Thank you for that, doctor. Let's quickly take a break. We'll be right back. I am the life, the pure many wish they were. I define what premium means to most and still defining. Every royalty asks of me. Dignitaries drink me with no question. I am not loud, so you won't find me in traffic. Seated at momentous ceremonies, luxurious events, and premium parties only. I am exclusive. With an unmissable presence in over 40 countries, I am global. I am the life of every occasion and gathering. I am Nestle Pure Life. Without any introduction, I am the life of the party. Welcome back. Thank you for staying tuned. Okay, we know that there are so many skin conditions from childhood to adulthood. Can you explain to us or take us through some of these conditions? What causes them, and how can they be, cured or dealt with?
Let's assume you've got a newborn baby, 3-month-old, 6-month-old, and the baby suddenly starts to develop rash.
Okay.
And baby is brought to see a dermatologist. And because dermatologists have been trained to identify and recognize different skin conditions. Children who are born and within the first year of life, they start to have rash. The first thing that goes to the mind of a dermatologist is that, maybe that child has got atopic eczema. Eczema, in the dermatology definition, simply means inflammation of the skin.
Okay.
Dermatitis.
Okay.
So if you hear of, in medicine, when you hear of titis, tonsillitis, inflammation of the tonsils, conjunctivitis, when you hear of titis simply means inflammation.
Okay.
So eczema or dermatitis simply means the child is got. And because it's starting very early, first year of life, the first thing that goes to the dermatologist's mind is, this child must have inherited the skin problem through one of the parents.
Really? I would have thought maybe because of the environment. Maybe it's dirty or because that's going to lead me to the next question about being contagious. But please go on. We need education.
So, this child most likely would have inherited through the gene, either through the father's gene or through the mother's gene, which is the reason why. And because you're thinking, a dermatologist starts thinking, the child may have atopic eczema. And when a child has atopic eczema, they tend to have recurrent inflammation of the skin, rash. The rash is itchy. You scratch the body all the time. And again, because of the inheritance of atopy or atopic eczema, or atopic dermatitis, apart from rash, they also have asthma.
Oh, really?
They come in groups, asthma.
But some children do have asthma without rash.
They may not.
Okay.
Everything in medicine is percentage.
I see.
You understand? The fact that the child has atopic eczema, more percentage of children with atopic eczema will have asthma, allergic rhinitis. You see, they're always having catarrh and things like that. But like I said, everything in medicine is percentage. They may not. So we're talking of, if you have, say, 100 children with atopic eczema, more percentage will have asthma, allergic rhinitis, more percentage will be allergic to foods and things like that. It's not 100%. So these are the things the dermatologist will start thinking, especially when the mother brings the child for the first time and you are questioning the parents. These are the things that, did the father or the mother also have rash in childhood? Anybody in the family, maybe some of the siblings, have they got allergic rhinitis, always nasal congestion, asthma, difficulty with breathing? They may or they may not. But these are the things that a dermatologist, a doctor who's been trained in the art of skin diseases, would ask the mother or the father. So that's the reason why it's important to take a good history also.
So, doctor, does that mean it's only children that can have skin conditions?
Definitely not. Definitely not. I mean, you could have even adults. Adults come out with skin conditions.
So, what are some of those that affect adults?
Right. For instance, just before you came to my clinic, some 10, 20 minutes before you came, I just saw a patient with psoriasis.
Oh.
A lady, she's about 60 years old.
Oh.
And she's been our patient for about 4 years now.
Okay.
The first time she had generalized rash, generalized itchy rash.
Okay.
Yes, immediately she came, we questioned her, we went through the usual questioning of a doctor patient. And looking at the rash, from my own experience, because of my lengthy years of experience, I suspected she had psoriasis.
Okay.
But of course, psoriasis is not just a rash a doctor suspects. We needed to prove it.
Absolutely.
So I took her to the theater. We did a biopsy. Biopsy, we cut a little bit of the rash out of the skin and we sent it to the laboratory. And the result came back and confirmed that she's got psoriasis. Now, psoriasis is an autoimmune disease. What that means is that, you know that man called God? He has put into our body system, your body, my body, everybody, defense mechanism, immune system that will fight outside invasion. Anything that is foreign.
That's right.
If you remember during the coronavirus, anybody who is hit by the coronavirus, the body will try and fight it off.
That's
Anything, even any infection, your body will try and fight it off.
That's right.
Those antibodies inside you that are fighting off diseases, they are your army. They are waiting to fight off foreign attack by any foreign agent. But there are certain diseases we call autoimmune. Auto means self.
I see.
Your antibodies that are supposed to recognize you and are supposed to wait until an outsider wants to attack you, they get out from your body and turn against you.
Wow. It comes divided against itself.
Against itself. And then people tend to get rash, and that's psoriasis. And of
What
course,
causes that, doctor?
so many things. It could just be caused by unknown factors. We don't know the reason why they turn against individuals.
Wow.
We know how to manage it. We know what to give to you to stop the self-attack. We give steroids, prednisolone, and things.
As such, contagious.
No, they are not contagious.
Do we have any kind of skin issues, skin disease that is contagious that, the people have to be incarcerated?
Yes, of course. There are some certain skin diseases that are contagious, yes. I mean, if you go say a skin disease, we call it vitiligo in children. When they go to school, once you see vitiligo, a dermatologist will recognize it. And when they go to school, they can easily pass it on to their contacts, colleagues in school. Children, they hug each other in school, they, play with each other. Yes, so those are contagious, but things like psoriasis is not contagious unless if it's now got a secondary bacterial infection. And of course, being the bacterial infection, it could be passed on to, but not the psoriasis.
I see.
Psoriasis itself, it's an autoimmune disease which is due to the antibodies turning against itself.
What are the things we should look out for? You've talked about, moisturizing the skin, and oftentimes that comes through the cosmetics, the creams that we use. What are some ingredients that we should run away from, for instance? As a dermatologist, I know that you know some things that when we see maybe on the container of our skincare products, we should know that this is a no-no. What else? Can you give us ideas of what those products are so that we know what will not do our skin any good?
Right, okay. That is a very, very good question. And it brings me to the point of the authorities, government authorities. I think it's the NAFDAC that approves the use of medications, including creams and things like that. We in the Dermatology Society, we have seen in the open market some creams, especially one in particular that comes to the mind of most dermatologists is Damovit. Also called clobetasol. But most people know it as Damovit.
Okay.
it is a very, 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 I can say very, very, very till tomorrow,
Wow.
potent steroid. And it tends to bleach the skin.
Oh.
And a lot of women who would want to bleach their skin, maybe dark in complexion, they want to become lighter in complexion, they use it. It should not be used because it's a very potent steroid. It could get absorbed through the skin
Okay.
into the body system, into the adrenal glands. It could stop the functioning of the adrenal glands.
But is that the only product of that kind? What are the things, the content of such a product that should make us run from such?
Well, it's going to be difficult to mention
The content.
the names,
Okay.
but I guess the advice a dermatologist would give is there's certain creams that when you want to, and of course, because you know that by law, anybody who is selling any product, you're bound to put, you're obliged by law to put the ingredients there. So if you find any cream that has got Damovate, should be careful.
Okay.
The other cream most people also, especially women, is hydroquinone to remove black spots and to remove dark spots. By dermatology practice, the hydroquinone that we're allowed to use should not be more than 2 to 4%. But because hydroquinone removes black patches,
Okay.
there are certain creams that's got up to 10% of hydroquinone. Hydroquinone, in very high percentage, has been known in rats to produce cancer
Wow.
of the skin. Perhaps not in human beings, but anything that can cause cancer in rats, then one has to be careful. It may also cause cancer, which maybe we've not, for now, detected. So things like hydroquinone, things like Damovate, people buying creams should be careful
And watch out.
and watch out for.
Okay. Among other things I'm taking away from this edition is the warning to be cautious of what you rub on your bodies. If something that can cause cancer in rats is infused into your body cream, I think that's a red flag screaming, run, run, run. That's the more time permits on today's edition of Talking Health. The concluding part will come to you next week. Should you want to contact us for questions, comments, or coverage inquiries, please do not hesitate to call the numbers on the screen. You can as well visit our social media handles to subscribe, like, and share. Until I come your way again, think health matters. Think Talking Health with Bunmi. Bye for now.